All right. Welcome back, everyone. I am Brett Norton once again with Beyond Clean, and joining me today is our UV disinfection expert, Daan Hoek. And Dan, I know that you've been with us about, almost a year now as far as writing expert series material. So I know that our audience is well aware of who you are and what you do, but I thought I'd give you a chance to just introduce yourself so everybody can get a taste of who you are.
Thank you very much, and thank you for having me, Brett, here. I really enjoy it. My name is Daan, one of the founders of UV Smart. Since 6 years ago, actually our birthday was last week, and we now exist for 6 years. We now have 3 products on the market, all based on UV disinfection for various medical devices. And within UV Smart, I'm responsible for clinical studies, validation.
Awesome. All right. So in terms of UV light, I know that, it got a lot of attention once COVID hit. Obviously, it was one of the alternatives to hospital surface disinfection, mainly because a lot of the disinfectants were just flying out the door. They weren't very available. And so I thought I'd just ask you real quick, in terms of a background, what types of UV light can be generated, and why is it useful for disinfection?
Yeah. So it's a great question. I will give you a short crash course, Brett, in UV light. UV light is just natural light, comes from the sun. It's emitted by the sun. And basically, ultraviolet light, you can put it in 3 different groups: UVA, UVB, and UVC. And the light that you've been talking about was very popular during COVID, but it's getting more and more traction in the medical field, is UVC light. And that's specifically UV light with the bandwidth between 200 and 280 nanometers, sorry. And that light's very effective against organisms, specifically because it's attacking the DNA and RNA. So what it does is basically detects the DNA and RNA of organisms, making growth and multiplication impossible, and the organism dies, to put it very shortly. But the good thing is about UV light, although it's emitted by the sun, it's luckily blocked by our ozone layer. Because UVC light is very harmful for all organisms. And since as humans we're also organisms, it can also be harmful to us. Because if we're exposed to it for a long time, you can even get blindness or burning eyes or welding eyes or even skin cancer if you will be prone to it for a very long time. So it's very effective for organisms. You kill everything with it, but you have to make sure that humans are not exposed to it.
Great. Yeah, and so we talk about the superbugs out there that are, prevalent and really hard to kill. So UVC is very effective, I would assume, in terms of killing those really tough to kill bugs that normally we would be using really harsh chemicals on.
Yeah,
is that right?
Especially if you look at spores, for instance, that are very hard to kill because they're covered on the outside. Basically, they have a little umbrella, as we call it. And we with UV light you can go straight to that umbrella and attack it straight to the core. And also we have superbugs that cannot become resistant to UV light because it attacks its core in the DNA and RNA. So that is actually a great benefit of UV light, and that makes also very effective against HAIs or fungi or spores or mycobacteria. So that's why it's becoming more and more popular. And of course, you said harsh chemicals. Also means that you don't need any harsh chemicals anymore. You just need to put on some lights. Of course, there's a lot of variables that you have to think of in order to have a well-disinfected medical device. But it means that you can run your processes much quicker, more efficient, with less chemicals. So it's actually a benefit and a win-win for everybody.
Great. Well, kind of walking back a little bit, you did talk a bit about the safety issues that can accompany UVC light. Can you talk a little bit about the safety precautions that are needed with UV due to radiation exposure risks or, ozone, that type of thing?
Well, it's good that you mentioned it, and I mentioned it before already, is that UVC light is very effective in killing organisms, but humans are also organisms. So you have to make sure that humans are not exposed to it. Because it can change the DNA in your skin, in your eyes, and it can cause cancer over a long-term period of time. So you also have to make sure that if you implement UV light into your hospital, make sure that you have your processes in place, or that the devices are designed in such a way that that your staff can never be exposed to the light. And of course, you also mentioned radiation. And that's also an interesting topic because a lot of questions that people get is like, oh, it's UV radiation. So they think maybe it's like an X-ray or like an MRI where you have to sometimes wear protective gear, for instance, next to an old X-ray machine. But it's not that kind of radiation. It is just light. So soon after the lights are turned off and basically it gets dark, then there is no harmful wavelengths anymore. So we always say it's just light. It's very aggressive light. But once the lights are off, there's no dangerous radiation anymore. And the last part, what you meant on, is on ozone. And ozone is indeed can be very toxic to humans. But you have to make sure that if you implement UV light into your hospital system, is that you make sure that the devices that you implement are filtering out the ozone generating wavelength. And that's around 183 to 185 nanometers. That's where ozone is produced. So always look at the technical data sheets of your manufacturer, of your supplier, make sure that they filter out that wavelength, because otherwise you will create ozone. And that's very dangerous again, also, because you can inhale it and recircle around in your hospital. So always look out for that with implementation. So basically, the three things are: make sure you're not exposed to it, make sure ozone is not generated. Those are the two most important things.
Right. And, we think about UV, you think about sunlight, and then you also think about eye protection. So are there specific, in-hospital eye protection PPE, that people should be using while utilizing the UVC light?
If you're going to be exposed directly to the light, what you should not do, then yes, you should wear.
Right.
Then you should wear protective gear. So the easiest way is answer is like, don't get specific eye protection. Just make sure that the device is turned off when you work with it or you walk around it. If you,
got it.
For instance, in our R&D labs, if we work with it, we have to do a lot of testing. But then basically all our colleagues are covered in a total suit. So none of your skin is available. And if you only protect your eyes, and still the skin around your face or in your hands can still be attacked by the UV light. So I won't recommend it. And not only wear like eye protection, but wear total body protection. But the best way is just to shut off the light and then start working on the device. Make sure it never turns on, or make sure there are safety measures in place that it can never turn on.
Right. Yeah, so you're not looking to get a suntan while you're working with these devices.
No, definitely, it's not the suntan that you want. Maybe go to Florida for that, but don't turn on your UV lamps. It's very harmful. At the beginning, when we started the company, both me and my co-founders were testing a lot and experimenting a lot. And when it goes, sometimes we were not wearing all our protective gear. And then when we were back in the car, I had burning eyes, and my co-founder, he had glasses on, but he has like he took off his glasses in the sun, so he had like a total worn off of it. So I really don't recommend it. It's very dangerous for humans.
Right. Great points, and thanks for adding to that. In terms of reliability factors, walk us through the key elements that ensure reliable, valid UV disinfection processes.
Yeah. Well, there's a few elements, but I think it's best to start with the basics. And we've talked a lot about the sun already, because it's natural light, and we can relate to that as well. So UVC light is just light, and if you want to, that means there's intensity. So you have a dosage that you have to have. So that can be joule per square meter or joule per square centimeter. That's how it's measured. And there are three variables how you can play with the intensity of light. And again, it's very basic, but it's time, distance, and power. So the longer you're exposed to light, let's say you're sitting in the sun, the more burnt your skin gets, or the more tanned you get. And the distance is also important. You can imagine if you sit closer to the sun, for instance, if you're in the mountains, or if you're near the equator, or the sun is turning towards it's summer, so the earth is close to the sun, you will burn faster. So the distance to the light source is also important. The last thing is the power of the light source. Well, the sun always has the same power, but imagine with UV light, you can have different strength of lamps that goes in watts. If you have your old, not LED lamps, but the old lamps that you still have, you can have certain wattage in your lamps. It could be 12, 36, 48, etc. So those 3 things are very important: time, distance, and power. So you can imagine that if you have an object and you eliminate from a long distance but for a long time, that it takes a longer time. But if you move it very close, you emit it for a short time but more powerful time, then you get more disinfection. So always make sure that those 3 things, those are the elements where you can play with. So if you do, for instance, room disinfection, it's very different than do an object disinfection for a medical device. Because a medical device you would like to have in a, a clear, closed container where you make sure that the, time, distance, and power is always the same. So you have a reliable and repeatable disinfection process. Whereas with the room, for instance, you actually want to go make sure that all the light objects are hit in the same way. So we make sure that the robots that do that have the systems in place so they can emit all the surfaces in the same way. That all has to do with time, distance, and power.
Awesome. Yeah, I guess you just said it, but time, distance, and power. I think that's one of the key takeaways from this.
And
in terms,
and then maybe sorry to interrupt you. One thing is shadowing, because we say the biggest enemy of light is shadow. Because if you don't get on your object the right source of light, that means shadow means no disinfection. Of course, you might with some shadow areas you might have a little bit of disinfection. Clinical studies show that. But however, if you want to get a good, reliable, repeatable disinfection cycle, as you mentioned, then shadow is your biggest enemy. So make sure, again, if you want to high-level disinfect a medical object, that you make sure that the device that you have in place has design features in place to make sure that the light comes everywhere of the medical device. And that you make sure that the light comes in every corner and every squeeze and etc. So don't be careful with that when you implement it, and just keep an eye out, because it's very logic, but make sure that shadow is reduced as much as you can.
Right, and we can get into it a little bit more, but in terms of medical devices, you certainly want to make sure that they're taken apart so you get every part of the surface of that device when you're using UV light. Discuss closed systems, training personnel, compatibility testing, motion sensors, etc. Can you just elaborate on those types of systems?
Yeah, sure. Especially for medical devices, as mentioned before, you want to have a repeatable and reliable disinfection. So you have to look again at the basics of UVC light, time, distance, and power. And the easiest way to do that is to have a closed environment, a box, a container, a closet, whatever, where you can position light sources in every angle of the medical device, so you can make sure that the light hits everywhere. That's basically what you want. And that is not only the best way to get reliable disinfection, but it's also the best way to protect its operators from being exposed to the UV light. Because as long as you close the lid or the door or that box, then the light stays in there. And then you can make sure that the object that's in that closed system is fully disinfected. So that's indeed very important. And one thing with the disinfection of medical devices, what's very important is to have an independent monitoring system, an IMS. I think we also know it from sterilizers, from AERs, is where you have an independent system that checks if the disinfection cycle was successful. And you can do that with multiple sensors in the closed container that measures the wattage through the lamp, or that can measure the UV dosage, or that can measure the light intensity. So to make sure that each disinfection cycle has been successfully. Whereas with an AER or a sterilizer, you can check it with temperature, pressure, steam, water quality, etc. And that's your independent monitoring system, and then the AER will release it, or the sterilizer. But with the closed system with UVC, you basically want to have the same in place, an IMS sensor that releases each disinfection cycle, so you know that if you disinfect a medical object, that is done correctly.
Okay. So a follow-up question, because, we talk about time, distance, and power. Time, I think, in terms of medical devices, is it consistent across the medical devices that you've worked with in terms of disinfection, or is it different? I know that a lot of those medical devices out there are very complex. So just in terms of time, is it set it and forget it in terms of all medical devices, or is it different across the board?
No, so it is different across the board, and always look very closely to the intended use of the the UVC disinfection devices. So in what systems have been validated for what medical devices, for what shapes, for what sizes, etc. So look closely to that, because the manufacturers of the UV disinfection devices should mention exactly what devices could be disinfected and are validated in their machine, not only in terms of disinfection, but also in terms of material compatibility, etc. So you have to look out for that, and there's a lot in the market, but do your homework and make sure that everything is well documented and well validated by the manufacturer.
Great. Yeah, thanks for that. All right, so let's switch gears and talk about best practices in UV medical device disinfection. What is the current state of UV disinfection in medical devices, and what trends are you seeing? Because I know it's becoming more and more prevalent. People are getting more eyes on it, especially with what you're doing in the industry. So the current trends, where are we with specific medical devices, et cetera?
So it is an ongoing trend, and we are one of the causers of it. But actually, the funny thing is, it's a very old technology. The UV disinfection actually won a Nobel Prize in the early 1900s for its disinfection capabilities, because they found out. But so far, it hasn't made its way in the medical field, and part is because we've been doing for the last 30 years with a lot of chemical and waters. So you see, if you look at the terms of guidelines of how to reprocess medical devices, how to disinfect them, all the guidelines are very much focused on chemical disinfection or solution-based disinfection. So if you say, what are the trends, what I'm seeing and where it's heading to, for instance, Amy recently released that they're working on a new technical guideline for the disinfection of medical devices, the TIR 118. So that's one of the trends that's going on, because Amy also recognizes that UV light has a big future, but we need more guidance in that. Even though it's a very old technology, we still need to apply the same rules to it and see how we can test in the best way. That's over on state side. So to say, if we look at the Europe side, we have countries like the Netherlands, France, UK. They're all already having guidelines in place or currently writing guidelines on UV light. So especially with these new emerging technologies, it's always a bit of the chicken and the egg. What is first? Well, normally it's always first technology, and then the guidelines will follow afterwards. So if you want to implement UV technology, don't only look at your guidelines, but also look at maybe other countries or other hospital systems where they already implement it. Because innovation will always run before the guidelines. So if you're interested and you want to move ahead to the future of disinfection, be open-minded to it, and look at a lot of clinical data that's being done by various manufacturers, and make sure, look at the draft documents, look at already published documents of various countries on how to implement it.
Yeah, and you mentioned chemicals, and I've worked with chemicals on the vendor side as well, actually sold into the space. And you talk about the water that accompanies the chemicals. It's damaging and can really disrupt the overall performance of a medical device over time. And so this technology would look to limit that. Obviously, it's because you're not soaking it in water. You're not using these harsh disinfectants that really do have an impact on just the overall performance of the instrument.
That's true. But again, as I mentioned earlier, look at the manufacturer that you're working with at their material compatibility, because also the OEMs of, for instance, ENT scopes or TE probes or ultrasound probes, they also have to do extensive testing with the medical device in order to give compatibility. So if you say, at harsh chemicals, yes, they're harsh. And we sometimes even get, when we run compatibility testings, feedback from R&D departments saying, oh, did you even test it? Because we don't see any material changes, or did you even run 1,000 or thousands of cycles? And we all say yes. So that's fun. And I think it's also better for the patient in the end, because sometimes you now see some studies coming out where there might be some residue chemicals will be on the medical device, and it can cause allergic reactions or can give problems to the patient itself. So in that sense, it's also safer. And if you maybe to go back to your first question, what are trends that you see in terms of the medical devices that are being reprocessed with? with UV light, it's now very broad spectrum. You have devices for ultrasound probes. They're being disinfected. You have devices especially for TEE probes or TOE probes, so we call it in some English-speaking countries. You have for ENT scopes, you have it for rigid scopes, you have it for vaginal probes, rectal probes. So it's becoming very popular, especially for these devices that have a high turnover and high usage, and where there are a lot of chemicals being used, but preferably you want to do point of care disinfection or near the point of care. It becomes very popular.
Yeah, and I think especially in terms of what you can't see, right, within the channels of scopes, and it's really hard to get a brush in there. It's hard to know whether or not you've gotten all the chemicals out. It's hard to know if the scope is dry. So there is huge opportunity in this technology. So looking forward to seeing how it progresses down the road. Actually, this is a good follow-up. What is the biggest opportunity today regarding hospital-based UV technology?
Yeah. Well, I think the biggest opportunity for hospitals is both time, I would say, and chemical-free disinfection. If you look at time, UV disinfection is very quick, it's very efficient, it is cheap to run per cycle, and it's chemical-free. Especially chemical-free, if you like it or not. The world is moving towards a chemical-free environment with zero emissions because we simply have to. Because when you implement UVC light, you can reduce your carbon footprint to zero. And especially for big hospital boards or big hospital systems, it's something that's going to be important across the world because unfortunately the healthcare system as a whole, as we are very polluting. So in the same way we're making patients and people better, but in the same way with our processes, we're also making people sick again to come back to the hospital, and that's not what we want. So I think chemical-free and the sustainability aspect is very big. And the other one, what I said, was time. And time you can break down in a lot of different parts, right? Time to reprocess a medical device, but also time it takes for a healthcare worker to reprocess a medical device with less water, less chemicals, and then they can see basically more patients. If you look at some clinical studies that were done on, for instance, ENT scopes, where they can see that the turnaround time went from somewhere between 2 hours back to just 7 to 10 minutes. I mean, with that same medical device, you can just see more patients in the day. We can see more patients in the day, they have a higher patient turnover. And then more patients can be helped. And this has an effect also on the quality and grading of the hospital itself. So hospitals who implement this, they can see more patients, they can do better diagnosis because they have always a medical device ready to look in somebody's nose or ear or do an investigation. And this will affect the quality and the grade that the hospital will have in its system. Because if you can see more patients in a better way, and do better diagnosis, then your grading will go up. So I see that's a big opportunity in just time. And I'm sure everywhere in the world, it's very hard to find good staff. Everybody's understaffed. The pressure of healthcare is getting bigger and bigger. We're getting more older people need more care. So if you, again, can design your process in much more an efficient way where it's much more time efficient, then you can have a major benefit over the whole line of your hospital system.
Yep. Yeah. And you mentioned the patient more than once, and that's the ultimate goal. We talk about this all the time on Beyond Clean, that, ultimately having safe, reliable instrumentation that can perform on the patient without worry of an HAI or complications down the road. That's really why we're here. And the efficiency piece, right? It's making sure that, okay, we can just move through this process and really ramp it up without worry of the patient being at risk. So those are great points. So in terms of, say, a hospital is looking to implement this technology and is really interested, really wants to pull this in, what advice would you give for reliable UV implementation?
Well, the first thing that I would advise one is to have an open mind. And that is maybe a weird advice, but you have to realize that when you implement a new device, your whole process will be different. So if you're gonna keep comparing it to an AER or to a human, it will be different. And you have different variables, you have a different process. So I would say be open-minded. If you wanna step into this and you believe in the technology and believe in it, be open-minded and be open-minded into your process, because you might have to reorganize things how they usually are. And I know change is always difficult for people, and it's always hard, and it's exciting and it's scary because, for the last 50, 60 years we've been doing with water and chemicals, so we all know what we're doing. But this means a change in mindset, but it also means you have to be open for, okay, we used to do it in, way B, now we're doing it in way UVC. So that is something that I can recommend. And besides that, but I think that's whatever medical device that you implement in your hospital, make sure they have substantial clinical evidence, that the device is user-friendly, that the manufacturer gives good implementation and training towards its staff. So those are the basics that really want to get into it. And of course, the things that we touched on before, time, distance, power, make sure you have material compatibility right, make sure you have all the validation documents right. So those are basically the basics, but the most important thing is be open-minded. The first electric cars were also not the same as gasoline cars, but now you see that it's being now they're everywhere. So and it gave it a mindset, because the electric car will still bring you from A to B, only in a different way. And UVC light will still reprocess your device from dirty to clean in the same way, but it gives a change of mindset to step into the future and to make our future for patients and for healthcare workers better and chemical free.
Right. Yeah, and you also highlighted too that it's not just a plug and play. If a hospital was going to implement this system, you or somebody on your team would be there to aid them through the process, to supervise, to make sure that they are doing it right. And it wouldn't be just, here you go, here's the technology, have fun with it. You would be right there with them along the way and throughout the entire, life cycle of the program.
Exactly, and it's not, luckily it's us. We have great colleagues from other UV companies, but I hope that all the companies do the good implementation, because that's where it stands or dies with UV light. But with any medical device in reprocessing, you have to make sure that it's implemented well. So just look at that and make sure that whatever partner you chooses, if it's UV, I'm already happy, because then you're already in the future. But make sure that your implementation is right, and that maybe those manufacturers can bring you to reference sites or can show you how other hospitals have done it. And they can take you step by step on how to implement this device or into your system.
Great. All right. Well, we've got a couple minutes, so I'll throw in some conclusion type questions for you. If you had one takeaway for hospitals on ensuring the UV disinfection process, what would that be?
Ooh, good question. You saved the best for last. I would say have good protocols in place, have the right implementation, and have the right training towards your staff. Also for your staff, it will be a change in mindset. So I would say protocols, implementation, and training would be most important. And then, of course, you have the other parts we talked about is documentation, validation, material compatibility, etc. But implementation is the most important way, or the most important aspect of reprocessing a medical device.
I was thinking that you were going to say time, but I think that there's a lot of angles you could take with that. But
time is a good answer. Time is an outcome of your implementation, because if you implement it well, then you have your time saving, and then you have a safe medical device that is well reprocessed for a patient. And that's, of course, what we're working to. But if you don't do the step before it, you have good protocols, you have good implementation, you will never get a safe medical device. It doesn't matter what technology you use, that's the most important thing. But yes, if you can do good implementation, you have good protocols, yes, time will be your biggest friend in this way. And it will. We have users from where we implemented it to change their life. They can see more patients. They love it. They have less damage. So that's all the outcome of it. But the key takeaway is, if you do it, have the right mindset, be open-minded, and implement it well. Because if you do that, then you have a substantial time savings, and you leave the world a bit better because you don't have any CO2 emissions.
Right. Awesome. Well, have one last one for you, and it's not overly complicated. Where can people find more guidance on UV light if they have questions?
Yeah, so if you, we have an independent blog with our company. If you go to uv-smart.com/UV Academy, it is an open source blog, open source library, I would say, with all the clinical evidence about UV light, about how to implement it, what it does, the benefits, the drawbacks, what you have to take care of. So I would people, if they're interested in and open-minded, go to that blog. Again, uv-smart.com/UV Academy, and you can find all the information that you want about UV light, the pros, the cons, experience from users, a lot of clinical evidence, what has been done, what not has been done. And it's a great way to start your journey into UV disinfection into the medical world, I would say.
Awesome. All right, my friend, I think that we will put a stop to this conversation right then and there. Some really, really great points, some good educational takeaways in terms of the benefits of UV disinfection on medical devices, and really looking forward to seeing how this technology grows in this space, because I do think that there is a real benefit to it. So I appreciate you joining us, Dan, and we're really excited to have you as our expert going forward. Looking forward to more great content. And if anybody out there would like to reach out to Dan specifically, he is available on LinkedIn. He's very responsive. I know for a fact because I email with him fair bit. And so please feel free to reach out to him on his LinkedIn page, and also connect with him, make comments, check in on his expert series every month that we've got going. So, Dan, thanks again. I appreciate you.
Thanks again for having me on the show. For everybody who's listening or watching, feel free to contact me about any question you have on UV light. We're happy to help you further. Thanks again, Brad. Great to have you.
All right. Here. Thanks, everyone. Dan Hoek, our expert for UV disinfection. Thank you.